I am absolutely delighted to introduce the 2021 Excellence in Community Campus Research Partnership Award recipient, the Parent Advocacy Project Team. This award is also sponsored by Schultz. I will say a few words about this project, but we will hear much more from the leaders. What was very impressive, we really found that the Parent Advocacy Project is a national research partnership which is seeking to address the devastating impact and stigma of the opioid epidemic across Canada and around the world. This partnership is led by Rebecca Haines-Saah from University of Calgary and Petra Schultz from Moms Stop the Harm. This authentic research partnerships involves many members from community groups and from coalitions, including Moms Stop the Harm, Moms DU, Moms United and Mandated to Saving the Lives of Drug Users, and the Voice of the Family, as well as several researchers from 3 different universities, University of British Columbia, University of Calgary, and University of Alberta. This community university research partnership was really for us special because it documents processes, motivations, and the impact of families advocating for policy reforms. The award adjudicating committee was especially impressed with the exceptional knowledge and community mobilization efforts of this project. Some of them include See Beyond website, amazing, podcast, film festival showcase, active contributions to the Opioid Summit, to the International Harm Reduction Conferences, to the United Nations talks on World Drug Treaties, also several academic publication, and new funding for community organizations and bereavement peer support groups. So please welcome Petra Schultz and Rebecca Haines-Saah.
Thank you so much for that, Joanna, for the kind introduction and for this award to the committee, for everyone who took the time to look at our project and selected. We are truly delighted and honored to have received this award, and also to have acknowledgement for a health crisis, which is really our other health crisis in Canada, and often a health crisis that is not much talked about, one that has taken the lives of over 20,000 Canadians since 2016. So to me, as a mom who's affected by this crisis, it means a lot that this cause is honored in such a way by you here. So I can't thank you enough for that. To tell you a bit about our project, I'm going to start and then hand it over to Rebecca. And for me, it always starts here with my youngest son, Danny. In 2014, when Danny was in recovery, he relapsed and he bought what he thought was one more pill of fake OxyContin, but in fact it was fentanyl. It was at the time when fentanyl just was emerging and Danny did not know what he was buying. Danny died, he was home alone, he died from an accidental overdose, and I found him in his home. And this tragic loss led me to examine, why did my child die? Was he a bad person? Was I a bad mom? And this examination led me to understand that really it is our failed drug policies that led to Danny's death and so many more. And this understanding led me to reach out to media, to health professionals, to other families. And together with other mothers, I founded the organization Moms Stop the Harm. We now have over 2,000 members Canada-wide. And our aim is to change drug policy, to make it evidence-based, but we also provide support to families across the country. And the work with Moms Stop the Harm in Danny's name, in the name of the loved ones that we lost, this is how I connected with Rebecca and with the other researchers and with the other moms. And it's really the lessons that we have learned from our painful experiences that guide us in our work forward, in our community work, and in the projects that we have engaged in. And I let Rebecca talk more about those projects and how we started out.
Yeah, we can move for this. I'd love to thank Shirk and also to CBRC and to everyone here today. It's amazing to be introduced to this group of experienced and, knowledgeable, passionate, community-based researchers, including, what's evident is so much Indigenous leadership and partnership at this event and in your group. I also want to acknowledge Heather Morris, who's on the call, who's the graduate student who was so key to carrying out this project and who submitted this award. So this wouldn't be happening without her. And also Miriam Khan, the stellar other award recipient that we're honoring here today. We conducted 2 projects, a qualitative research project with 43 parents, mothers whose children died from opioid poisoning and other drug-related causes since 2016, largely due to fentanyl. And then we engaged in a knowledge translation project to produce some videos to share those findings. And we've done a lot of advocacy work together, a lot of conference presenting. And throughout this, I think we've learned a lot about how to work together. We're a team of, emerging, early career researchers and experienced community advocates working together. And we're all mothers now. We weren't all when we started the project, and we've learned together. We learned about equity, about always sharing space for presentations and for papers and for taking credit for the project. We learned about resolving conflicts and working through hard times, because this is a topic that comes with a lot of trauma. And so sometimes, things are emotionally loaded, and we work through these things, I think, successfully and beautifully together. And we learned about making sure people were paid for their time and compensated well, and really making expectations clear. Sometimes academics move much too slow for a community, especially when it's advocacy and policy change needs to happen yesterday. So we continue to work together to shine a media spotlight on this crisis. It's just hard to communicate what this project has meant to me. I'm going to get upset, sorry. But it's really been so important to me, and it's such an honor at this time when we're all isolated to, to receive this award. So I'm so honored to work with this team and, to continue to work together, hopefully. So thank you, and I'm sorry for crying. We can go to the next.
Don't be sorry for crying. That was beautiful.
Thank you, Rebecca. Thank you, Rebecca. I know that Petra would like to say something else, right?
Yeah. So I want to talk a little about what this research has meant for us as advocates, as families. When we started out, for us, it meant a lot to share our stories. When you lose a child tragically through something like substance use, it's so heavily stigmatized. People don't really want you to talk about their child. They want you to get on with it. So we took this opportunity to share with the researchers about our children, our story, and the advocacy that we work, and what we learned from sharing their stories and the analysis of the research that informs our advocacy work now. And a very important learning from the research was that in order to be effective as an advocate, and that is something everybody can take away, is you have to practice self-care. You have to look after yourself. So as a result of the research, we started peer grief support groups that we now operate, and actually just received a grant from Health Canada and to launch these groups Canada-wide. They're called Healing Heart groups, and you can learn about those on our website. And in getting this grant, again, our partnership continues to evolve. We had the knowledge translation project where we shared our stories, and you see that on the See Beyond website, but also the research and the work with our partners, especially Rebecca, was instrumental in us and getting the grant, and Rebecca will continue to help us evaluate the work that we do with the grief support groups and family support groups. But we also have researchers at our disposal. We've learned that as families, we have powerful voices in sharing our stories, and there's power in the narrative. But we want to do what is evidence-based and support what we see with the evidence, and that is where our research partners help us and point us in the right direction. They can guide us. They also have helped us find new allies in the research community and otherwise that we know closely with. And most of all, I have felt that our research partner have always been there for us with unconditional love and support. Advocacy can sometimes be challenging, especially if you don't have a large budget. We engage a lot of social media, and it can be an ugly place. And we know there are people who will also always have our back, people who stand by our side and support us when we go to conferences, especially Heather, the PhD student, and I, we went to Portugal together and presented at an international harm reduction conference. And for me as a mom, it's not often that somebody is there and always makes sure, are you okay? Is it too much? So the entire process for us has been so powerful, and this research work and the team and the people in it is really a big part of what we do in our advocacy. And I'm so thankful to have had this opportunity to do this, and I'm so thankful that it's recognized here with this award. So I want to what I want to leave you with is the image here is something that Rebecca initiated and we worked on over Christmas, and we wanted to demonstrate that the people who die from overdose, they're not numbers, they're people, and they're people who are loved. And so we have profiles on our website of people that we lost, and we looked at obituaries and we talked to people and found these phrases that describe people. So each phrase represents a person, and there the images altogether is over 1,000 people representing those who died in Alberta alone in 2020, because the overdose deaths have skyrocketed during the pandemic for a number of reasons. So you can find these also on our See Beyond website. But if I look at those, I see a person in each and every one, and that's so important to remember that we're talking about people, and that's why we need the work. We need to change what we do, and this research supports our advocacy in doing so.
Thank you so much, Petra. Thank you very much, Rebecca. This is why we are talking community-based research is transforming lives, and also authentic community campus partnerships. We want to showcase them and inspire others. So thank you very much.